As 50 million students, 3 million educators head back into the classroom, whatever form that looks like these days, there are still so many questions about how to do it safely. The answers seem to vary district by district, school by school, state by state. And so to get some perspective on it, we want to have a conversation today with Sylvia Burwell. She's the president of American University here in Washington. She's also the former Health and Human Services Secretary. So she has some real expertise in health policy. It's great to have you with us.
Thanks so much for having me today.
Let's start off with American University and the decisions you've made there. There are a lot of nervous parents packing their kids up to go back to university in person around the country. At AU, you made the decision to go fully remote. Tell me about what went into that calculus.
First, what we had announced was that we would bring back about 50% of our residential students and that we would be blended in our approach, some online classes and some face-to-face classes. But on July 30th, we announced that we would go fully online. And that decision was based on changes that occurred throughout the summer. And there were a number of changes, but I focused mainly on 4 fundamental changes. The first was the case count across the country. At the time I made the original decision, we were in the 20,000s. At the time I made the next decision, we were up around 70,000. And after consulting a lot of epidemiologists about where they thought that number would come down to, we have students from across the country, those numbers were still very high. The second element had to do with testing. And this is a topic that many people are discussing. And the issue of having testing capacity and the timetable that you can get testing results. And as that continued to rise and our ability to think about how we would be able to do that with the students became more and more difficult, that contributed to the decision. A third element that contributed, all the schools in the surrounding areas in the District of Columbia, Maryland, and Northern Virginia, where our faculty and staff live, those schools went online. So all of our faculty and staff, many of them, their children would be in their homes. And then finally, in the District of Columbia, the mayor made a decision that anyone coming from states that are hotspots, where the cases are above 1 in 100,000, would have to do a 14-day quarantine. So we would be bringing first-year students to the university for their first time, many of them living away from their families, and they would be in a room isolated for 14 days. All of that came together to believe that the best decision was to change that. And we had 3 principles: health and safety of our community, how do we best deliver on mission, and how we contribute to both the health and economic safety of our community.
There has been this desire to have more clear benchmarks set. Some have asked for from health officials like the CDC, things like setting a benchmark for a positivity rate to decide when to open or close. But what you're laying out here is a level of complication that goes far beyond that.
Yes, I think it is. You do have to consider a number of facts. But referring to my old job in terms of how I think about these issues and frame them, when we think about these public health crises, thinking in terms of prevention, detection, and response. And you actually have to think about all 3 together and where you would be in your ability to do those things. And as we think about that, using the basic public health tools that we have and how you measure your ability to use those tools and how effective they can be. That's testing, contact tracing, and isolation. And those are supplemented with the basic prevention that people do of masks, social distancing, and hand washing.
I mean, all those factors are so important, but you also have to be able to continue functioning as a university. I know you did reduce tuition a little bit to offset this, but how tough is it? Are you concerned that this is going to depress enrollment rates going forward?
So for universities across the country, this puts financial strain on them because we all are very tuition dependent, and it does change our enrollment numbers. It can possibly change your enrollment numbers. At the same time, it can also doesn't change your expenses. Faculty are still here, they're teaching, they're doing it in a different mode. But in terms of how we're thinking about that issue, one of the things we put front and center, and this was that third principle in thinking about the economic impact and health impact, as well as our AU families in terms of their health, we actually have done a number of things to know and understand the strain our families are under. We increased our financial aid by $13 million from our levels last year so that we can try and help families more. The second thing that we did, you mentioned, we did a community cares tuition discount of 10% over the period of the fall to try and help and support families. And the other thing that we have done is to make sure that we kept cost of attendance constant so it wouldn't change our students' financial aid packages. All of that, together with the pressures, does create challenges. I'm lucky here at American University. While we'll have to take hard steps, we actually have put away reserves that we'll be depending on, as well as some of the steps we'll need to take.
If you look at just what's happening to the country right now, there has been so much job loss related to the pandemic. And as those jobs go away, health insurance goes away. I saw an estimate that more than 5.4 million Americans just in the spring lost their health insurance. That number may have climbed since then. Seeing that, what are your concerns about the strain on the system, particularly as it relates to the Affordable Care Act and to the options that those who are jobless may be looking into right now?
So fortunately, the Affordable Care Act is what can be referred to as a counter-cyclical policy. And that means that when there are economically difficult times, it's something that can help and kick in. And it's extremely important for people to know that those who have changed circumstances, in other words, if you lost your job, you can actually go into the marketplaces and get that insurance. And that insurance is subsidized. And so I think the Affordable Care Act and also the expansion of Medicaid in the states that have done it are important help for Americans in terms of their health care and their economics as they go through these very difficult times.
But as you know, being able to buttress the Affordable Care Act has been a heated political issue for some time. The Trump administration hasn't done many of the things it said it would do to change the law. The Biden campaign is talking about health care, but if you even just look at what Joe Biden has said versus what Kamala Harris has said, they had some different views on what healthcare should look like going forward. So do you think that the pandemic has changed the politics of this, and that, what can people expect in the year ahead in terms of what that system will look like? What option will exist for them?
So I think that the issue of healthcare is an issue that we know was very relevant in the most recent midterm elections. And we know that many people are focused on the important issue of healthcare going into this before COVID-19. And I think that COVID-19 is just going to bring the health and the healthcare issues more to the forefront as people are thinking about the issues that are most important to them. Building on the Affordable Care Act and making sure that you are not tearing it down, that you build on the progress that you had, and you think about it in terms of access, affordability, and quality. And I think, one of the most important things right now is not doing anything to damage the Affordable Care Act. And one of the things that's most threatening is the court case in Texas to do that. And I think bringing down that case would be one of the most important things that anyone could do. And if the administration made that choice to do that, that's something that could further stabilize the Affordable Care Act. And then you can build on the places that you need to.
On the question of you as an administrator right now, how do you decide when it's safe to bring students back? Do you know the factors that you have on your checklist?
I spent a lot of sleepless nights making the decision to change us from what was a blended model with some students coming back to where we are now. And as I thought about that, as I've said, it has to do with case count, ability to test, the speed with which one can get that testing, the ability to do the contact tracing, and the ability to make sure that you have isolation capability. Because as I said, you have to think about it in terms of prevention, detection, and response. We want to do everything we can to prevent cases. That means lower case count. That means using testing as a form of surveillance, not just a diagnostic tool. And it means that once you understand that, being able to control, so you control the potential outbreaks that you would have on campus. And so those are the measures that we are looking at very closely as we do that. Of course, that's at the sort of 30,000 foot level, but then there are other considerations that come in when you talked about the complexity. One is making sure that our faculty, certain faculty we have, are in categories where they would be more susceptible to damage from COVID-19. And so you have to add in those considerations as well.
So you have to build out that infrastructure from within, the contact tracing and the access to testing. Is that what you're saying?
So I think, that gets to one of the questions about what we should be doing as a nation too. And now I'm with my former HHS hat in terms of controlling the pandemic broadly. And there are national elements that need to occur. And a national approach to testing is the way that we will get to the place where the testing capacity and the testing speed that we need is there. Right now, we are doing it in region by region, sector by sector, and an overarching approach is something that would be very helpful to getting to the place where you can do things like bring the schools up, elementary and secondary, and your universities. And it will be the backbone on which we can build the rest of bringing the parts of the economy back more fully. I think it's important to recognize testing won't be enough. You have to do the contact tracing, and you will have to do isolation when you find out that you have it. The other thing is you really have to do those public health measures. And that's where we as individuals are so responsible for helping make this better. And that's the masks, that's the distance, that's the hand washing. And I'd be remiss if I didn't mention getting your flu shot.
All right, President Burwell, thank you so much for your time today.
Thank you for having me.